Welcome to the Doctor Diaries. Today we have the absolute pleasure of speaking to Dr. Mansoor Mirkazemi. Mansoor is a plastic surgeon in Melbourne, Victoria, Australia, and he's the director of Premier Cosmetic and Plastic Surgery. Mansoor specialises in cosmetic surgery, plastic and reconstructive surgery. And it's been my pleasure to know Mansoor for quite a while. So welcome, Mansoor.
Thank you so much. Thanks for having me, Hanya.
Absolutely my pleasure. So yes, Mansoor, I've known you for quite a while, and I actually have heard your story from you many times, and it's absolutely fascinating. So I'm so pleased you're on the podcast today to share it with us. So maybe I'll hand over to you, and you can take me through right at the beginning why you were interested in moving into medicine and even moving to Australia. Tell me all about it.
Okay. So it is a longish story. I was born in Iran. I was born in a small village in a city that most people, even in Iran, they haven't heard of. It's called Birjand. And my parents, neither of them were educated, but they worked really hard and they had extremely strong work ethics. And they were well known in the region because of their generosity, because of their goodwill, and because they helped out anybody who came across them. And the first probably 8 years of my life, I was living there. And this was a place where there was initially no electricity. And I remember my dad one day brought a fridge that was being run by kerosene. And I thought, how is it that you light up a fridge and it cools things down? It was really fascinating to me. But we had to go and get our water from a well and had kerosene lamps. And I think towards the end, we had electricity at night. But my mom and dad, and this is especially my mom, she's got a vision, and she had a vision that within a few years they would move to the city and they would buy a house. And of course, my mom picked one of the biggest houses in the city nearby that was next to my auntie's house. And of course, everybody laughed and said, come on, you got no money, how are you going to do this? But they really worked hard and they looked after people who worked for them. And when I was 8 years old, after grade 2, we moved to Birjand, which is the city I lived in for a few years. And the next 2 years were comfortable. As kids, I had my cousins living next door to us, and I had most of my family around. It was lovely. And when I was 10 years old, the revolution happened. And I remember clearly we were playing soccer, which we used to do almost every night across the road. And it was getting so dark. We used to play until we couldn't see the ball anymore, and then we'd stop. So it was getting so dark, and somebody came and said, look, the king has been overthrown. And that was sort of the end of our happy times. I went home and, clearly people were upset. My parents, my family were there. And the next 4 years, 5 years, they were really difficult. And the main reason for this was the persecution that the government inflicted upon those who were not of recognized religions. So, it was not easy. There were insults. There were, kids that would write things on the board that were really hurtful. And I remember there was an essay. I was in grade 7, and we had an essay that was given to us on war and peace. That was the title. We had to go and write something on it. And of course, I went home and I thought, well, peace, of course. And I wrote this beautiful essay on peace, pro-peace. And when I turned up to the class, my teacher, the only one he asked to come and recite the essay was me. So I went there and I read my essay to the end, and it was silence. And I thought, what is going on? And the teacher did not say a thing. He just grabbed my essay and walked out. And then he came back, and this class goes for about 50 minutes. He came back and he's sitting on the window ledge. He keeps looking outside and complete silence. And for about 40 minutes, this went on. Did not say a word. And I thought, oh, he's waiting for these guards to come and pick me up. But for the next 2 months, the principal kept asking me to go to his office, and I couldn't tell my parents. They were already in a lot of trouble themselves, and I didn't want to add to them. So it just, that sort of the hardship and the persecution that they inflicted on everyone really, affected most people. But of course, you learn from these, and you're trying to use it to your advantage. You build resilience. So it really, I'm saying this because it really helped me develop who I am.
That would have been so difficult, Mansoor, just that, especially in such formative years, your young teenage years, but really living in that fear, but still wanting to say what you believe and stand up for yourself.
Look, it was the same for a lot of people, and we were still fortunate. We did have quite a few of our relatives go to prison, but immediate family, we're all still alive. And which sort of reminds me, it's around about the same time, I would have been in grade 6, that we had this really young, wonderful doctor coming from Tehran to work in our city, and his name was Farhad. I won't mention his surname. He would have been in his mid-20s, extremely generous, looked after the poor people, and everybody loved him. I don't know what was with this man. I didn't know him, but I knew that all my relatives loved him. They kept talking about this 25, 26-year-old guy who'd come to the city, and he was a doctor and was looking after everyone so well. And when I was in grade 6, he got captured and put in prison. And I remember in the morning, we had to line up before starting our first lesson. Everybody was in the schoolyard, and they were talking about this, and I was thinking about this poor guy called Farhad, and I was thinking, my God, is he being tortured? Why? He's a doctor, he's trying to help people. Why did they put him to prison? And I, in a way, I sort of wanted to be him, because everybody idolized him, and he had such a sweet face, such a sweet mannerism to him, that you couldn't help but fall in love with him. But in any case, there was a lot of persecutions. My uncles were in prison for a while. My dad had to escape for quite a few months. And my mum ran our household, and she couldn't drive. So I was 13, 14, and I had to be the man of the house. And my mum said she is extremely cautious, and yet she is a lioness. She's got courage. So she said, look, Mansoor, your dad's not here. I can't drive. You need to start driving the car. And we had this massive Land Rover. And I said, okay. So I just went there, and my dad had shown me how to drive, but as a kid. So I took the car out, and we had to drive to my granddad's house. And for a few months, I had to drive, I just found my mom, who is always so cautious, asking me to do this.
Well,
but
she was
again,
yes, she obviously saw, you're in a time where you just had to pull ranks and everybody had to pitch in.
We did. But, I sort of looking back at this, and I'm thinking, so strange. Like, I would never get my son to drive, but those days you just had to do whatever you could. But I said, fortunately, my uncles were released, my dad came back, and at those days, and even now, only certain people can enter university. So my grandparents, who had, my mom's side, had 10 children, and education was important to them, even though they were not educated. Some of them were not educated, but they really my granddad's wish was for the children, and especially grandchildren, to be educated. And that wasn't possible for us, as well as all the persecutions and imprisonments. And in '84, a couple of my cousins left Iran. They escaped to Pakistan, and we sort of knew how to go about it. So a few months later, we left Iran, and it was hush hush. I couldn't even say bye to my grandparents. And I remember we were back of our car, and it was, I think, still a Land Rover, which we kept for many years. And we went to see him on the way to Tehran, and we just said goodbye and didn't tell him we were leaving the country. And I just remember turning back, and I saw my granddad disappear, and that was the last time I saw him. Very sad when you sort of have to do this, but anyways, we went there. We went to Tehran, and we flew to one of the border cities, and there were 12 of us, a couple of my aunties and my older sister and I, and it took us the whole day. We were driven across the desert and mountains and got to Pakistan safely. And it was only then that it hit me that, oh my God, I'm 15, my parents are in Iran, and I may not see them again. It took me a few days to accept that. And I remember we were about 15, 16 of us, refugees who were in this one tiny room in a small village, and we were waiting for the plane to take us to Karachi. And one day I was so upset, I just left the room and I went and walking around the area. And I started crying, and I thought, God, this, I don't know if I've done the right thing. I really miss my parents. But that was the day that I thought, well, this is it. There's no choice, have to deal with this. And from then on, I was comfortable that we were heading in the right direction. And I had my auntie, who's only about 5 years older than me, who accepted to look after us. And that was so sweet of her, otherwise we would never have been here. So my auntie and my sister were there, and we lived in Pakistan for 2 years. And even though it was difficult, and yet we had freedom, we had hundreds of refugees living there. And I was 15, but I got involved in a lot of committees and organizations that looked after refugees. And I think, when I look at it, I'm thinking that was unusual. I really put a lot of effort into it, and I really cared to do as much as I could for these committees. And of course, and this is a coincidence, but one of those committees, they wanted to connect to the families of people whose relatives had been executed in Iran. And there was a lady who would have been in her 40s at the time, whose husband was executed in 1981, and her daughter, who were refugees who just come to Lahore. And I had to go and say hello and welcome them and see if they needed anything. And I went there and I met them. And the daughter is now my wife. We got married after a few years. So that was so sweet, so lovely. That we were only just friends, we were not even close friends, but we met there, and a few years later we got married. So that was those 2 years, even though I had no schooling and really not doing much, but it really contributed a lot to who I am, and also being organized and being methodical, and having an agenda for things that needed to be achieved. So that, to me, that was great. And also to do things for others who were also there in the same situations.
That's interesting. Mansoor, just listening to the story so far, that you literally had to grow up from that day. Your mum said, you have to drive the car now. You escaped, and then that fact that you could, as a 15-year-old, in your heart, you're saying, I have to help others. We've got 15-year-olds around us, is that what comes into their mind? Dealing with these sort of families that have your own and others that have suffered such horrific traumas, unbelievable that you've come out of it. And as you were just saying, it's, what you found was that you needed to care for others. very interesting. It's very admirable. And to meet your wife, it was a beautiful love story as well.
So that was really lovely. But you know, it's I give a lot of credit to my mum and dad, and especially my dad, because I did spend a bit of time with him when he was driving around. They initially, when they got married, they were weaving carpets, Persian rugs. And then my mum said, look, we're never going to get anywhere making rugs ourselves, so we got to start buying and selling. So sent my dad to buy from others and sell, and we still had people coming into our place. So I did travel with my dad around surrounding villages, and it's funny that every time I was with him, he would stop and help someone. You know, if someone needed a ride, if somebody needed money, whatever, he'd say, yeah, look, just come, you know, we'll take you there. And even if they live far away from our destination, he'd still take them there. So, you know, I give a lot of credit to him. But yeah, look, it's better than, you know, you really feel that you have a responsibility, and that's what he sort of instilled in me. That, and even now he's almost 80, and anybody in our relatives, and we've got a whole heap of relatives in Perth. Anybody who wants something, they just ring my dad, because he'd gladly would go there and do whatever he can, or whatever he's asked, he'd do it. And they never talk ill of anybody. That they, you know, all they want is the best for everybody and the children. So it's good to have that, to have had that background and that experience with him, even though it was only 15 years. But in any case, yeah, those 2 years in Pakistan, they were difficult, but quite formative. And my sister, who was only a couple of years older than me, he got married when he was there. This boy just kept coming and persisted and stole my sister's heart, and they got married, and that was in 1986, and they're still married. They got 3 lovely boys. But you know, I have a lot of people to thank in those 2 years. One is my sister, who was sort of my everything, really. She was my mom, she was my dad, she was my family, and my auntie who was with us. And finally, after 3 attempts, we got our visa to Australia, and I remember going to the embassy, and we got rejected a couple of times because we were underage. But I remember the picture of this guy with sort of silver grey hair on the wall of the Australian embassy in Islamabad. It's the High Commission in Islamabad. And now I realize it's Bob Hawke. And to me, he was like a god. I thought, this man is the man who's going to take us there. So
that's amazing. And what at that point is probably the collision of 2 separate lives. So just to that moment, you've lived an entire lifetime for most people, yet you're about to embark on an adventure for a completely second lifetime. And you know, it's just amazing that, you know, to think that you've experienced so much as a young person up to then.
Fortunate. I mean, you know, I was, even though it was difficult, but without difficulties, you don't appreciate comfort. Without incarceration, you don't appreciate freedom. Without darkness, you don't appreciate light. So it was necessary to me. I think, you know, where my efforts after I came to Australia, they were a culmination of what I had experienced, and I had to, you know, do the best I could to make something better, you know. And I could see what was happening to all my relatives who were still in Iran and my friends, and I had an option, and I took it the best way that I could. So when we came to Australia, we landed in Melbourne first for a few hours, and then went to Hobart. And the smell of fresh air was unreal. And this was May, which was fairly cold in Hobart, and it snowed that year. And we went from 50-degree heat to almost 0 degrees in Hobart. But you could smell the freedom, you know, you could smell the future, because I thought, this government is going to look after us. And that was heartwarming, because at that time, my uncle who sponsored us, he was in Adelaide, but he got a position to study at the University of Tasmania. So that's how we moved there. He was our sponsor. And this uncle, he's probably about 5 years older than me. My grandparents kept going and going. So they had 10 children, and the younger ones were our age group. So he had finished year 12 in Iran and couldn't go to uni, so he had to start earning money, and he became a watchmaker. So he went to the northern cities of Iran and he started repairing watches. And he was doing that for a few years. He got married at a young age and then escaped to Pakistan and then came to Australia, and he entered the School of Engineering in Hobart. And again, I have to thank him, because when I went to Hobart with no English, I had to start studying. And he was the man I had to go to and said, "Uncle, can you tell me about this problem? Can you tell me how to fix this, and what does this mean?" So he really helped me out a lot in those first couple of years. And of course,
amazing. What age were you then, Mansoor?
I was 17 when I came to Australia.
Wow.
And
no English?
Very limited. So we did do English classes at night, and I studied chemistry and physics and maths during the day. That was the first year, and then second year we entered year 11 and 12 with my sister. But this is what I'm saying about opportunities, that if you're denied your human rights, if you're denied education, you really want to do the best you can to achieve that. So he was a watchmaker, and in Pakistan he actually taught us how to repair watches. So we used to go to this watchmaker on the street side and borrow some watches, and he'd teach us how to take it apart and put it back together, which is extremely fiddly, extremely fine work. But I loved it. I really enjoyed it, and that sort of gave me a direction for future life. But he studied, and of course now he's the professor of engineering and dean of his faculty and president, vice chancellor of his university, and the president of the engineering society. So it tells you that the past will paint your future. It does affect your future, and if you use it wisely. So I did year 11 and 12, and I did fairly well, but that was because I was studying day and night, and partly because if you can't understand a sentence, you've got to keep opening the dictionary, see what it means, and you had to apply yourself. And fortunately, all my relatives were studying as well, so that made it easier. We had nothing else to do, and we had no money to do anything anyways. And when I finished year 12, I had always wanted to go to Israel, and I had worked my summer holidays and some weekends, and I had about $2,500, and I could afford one ticket to go around the world. And I bought that, and I thought, okay, I'm going to go there. And, it was lovely. I went and saw my auntie in the US, and on the way to Israel, I stopped in Scotland to visit my friend, who is now my wife. And Israel was very interesting. A lot of volunteers were there, and that's really when I opened up. I could actually start talking to people, because there were so many young people from about, I think, 75 different countries who had gathered there to do volunteer work. And that year also was quite an important year in my life, because of my interaction with so many different backgrounds. And I was flatmates with an African from Cameroon, from Morocco, from the USA, from Iran, from Canada. Amazing to see where they've come. And I had applied for medicine before I left, and I withdrew, but I applied again from Israel, and I didn't know whether I had got on. But when I landed in Melbourne, and now my uncle was living in Melbourne, they picked me up and said, "You got in." Oh, that's amazing. And I know that it wasn't a dream of mine, because I didn't think I could get there, but I thought, oh my God, I can't believe that, this has happened. So I was really, really excited about it. And the next few years lived in Hobart, and fortunate to have had really nice friends in med school, even though I really didn't have close friends, but they were all supportive, and that's how I got in.
Wow. Well, that's just the beginning then, isn't it? That's as I said earlier, that's an entire lifetime just to get to that stage. But now you've lived a completely different life. So you're in Tasmania, you're doing your medical degree. You're married with your wife at this particular time, and you're in Tasmania, and then you finish your degree. So take us from there. What was the next steps?
So in medical school, I was interested in doing pediatrics. And later in my 5th year, I was interested in oncology, in hematology and oncology. And I did my elective in that field as well. And then I realized that I was emotionally too involved with my surroundings. And it was very hard for me to work with those who were not going to live. And I saw a lot of people dying from cancer, and I thought I really can't cope with this because it affected me a lot. And I finished med school. I thought, well, I like surgery, and I'll go in that stream. And my first job in surgery was in cardiothoracics, which involved really fiddly stitching of the vessels. And I thought, this is for me. I really like fiddly stuff. Used to do watchmaking. I can do this, and I'll be good at this. So that was my goal initially for a couple of years. And after that, the 3rd year of or first year of my registrar year, we had our daughter, and I thought, well, I'm spending day and night in hospital, and this is really stopping me spending time with her. So I withdrew from surgery. I had sat my first exam already, but I decided to discontinue. And about a year later, I thought, no, that's something that I really enjoyed, and I should go back to it. And in terms of plastic surgery, I really had little interest in it, because I really thought it was mainly cosmetic with maybe skin cancer. That's what I had seen. But my last job in surgery when I was a basic trainee was in plastic surgery. And we had this plastic surgeon who'd come from South Africa, and he did amazing reconstructions. And I remember this guy whose upper eyelid had been lost due to an unfortunate incident. And he made him an eyelid from skin attached to a blood vessel from back of his ear, put some cartilage there. And I thought, this is fascinating, but still, it's really not for me. And this guy, was 3-4 days later, he had a lot of venous congestion, which is where you get too much blood in that piece of skin that you've created the eyelid from. And we had to attach leeches to his upper eyelid.
Oh.
The first one we put on, this guy, freaked out. Oh my God, I've got a leech that's right in front of my eye. But by the 2nd or 3rd day, he was reading his paper with a couple of leeches attached to his upper eyelid and didn't care at all. It was really interesting stuff.
Yeah.
This is Mr. Frank Kimball, who interested me. And then I was also assisting another surgeon, Mickey Pole, who did interesting work. And I thought, gosh, I think this is a lot more than I thought. In any case, I thought I'd go back to surgery, and it was late in the year when I decided to go back. And my son was born in December of 2000. And this is something that's hard for me to say, but that sort of influenced my decision to do plastic surgery and to pursue it. And my cousin, who was really like my sister, we were neighbors in Iran and probably spent more time with her than any other family member. She had an accident in Hobart and passed away. She had a terrible car crash. And my cousin and I, so her brother and I, we had to go and identify her. And You know, when you get hit by a truck, um, your face does get deformed, and they did the best they could. But when I saw her, I thought, you know, I just don't want people to live like this, and I don't want people to be injured like this, and not, you know, and there's just things were running through my head, and I thought, okay, I'm going to do some reconstruction. This is what I really want to do, to help people who survive these accidents. But that was obviously, that sort of hasn't really, that's not my specialty these days, but that gave me motivation to pursue plastic surgery. And as luck would have it, even though there was no job in plastic surgery in Hobart at that time, somebody else had taken it, but fortunately he was offered a training position in general surgery and left his position. And my boss, Frank Kimball, said, look, if you want to come and do this, please, you know, you could come and do it. And I thought, fantastic. So that was my first year as a registrar in Hobart. And
that's interesting, that as you know, story of, you know, what learning how to watch make and the experience with your auntie, all these things, everything in life really leads you to decision making that steers you in a particular direction. It's very interesting. And this opportunity opened up, which is fantastic. So how did that go?
Well, for the first 3 months, it didn't go too well. I had my senior registrar who, he's an amazing person, control freak, and he did everything that had to be done, and he worked day and night, and that was just his personality. So there was not a lot for me to do, and I thought, well, this is cushy, you know, this is easy. But then after 3 months, Frank said, look, this is, you know, not how it's going to run. You got to do a lot more, take a lot more responsibility. And he sat me down, and that was another moment in my life that I thought, no, I got to do this properly. So then I picked up my act, and I did pretty well for the next 9 months. And I got into a general surgery training program and applied for plastic surgery. And after 2 years, I got accepted. So we moved from Tassie to Sale in Victoria to do general surgery, and the year after at Monash and Dandenong. And I didn't know any plastic surgeons in Melbourne, but you know, that was not necessarily a dream of me. It was something that I thought I could do well. And you know, again, learning from my dad, he just did everything right. He just said, look, if I need to do something, I've got to do it right. You know, if I need to make this carpet, the color has to be right. You know, the design has to be right. It can't be crooked, it has to be straight, has to be the exact dimension. So that he was very particular in his work. And that's what I learned from him. So in general surgery, I really enjoyed it. And the aim was really just to do the best I could for the patients and for the unit. So I was again fortunate that I got in, yeah, after about 4 years of training in general surgery, I finished and I decided to stay in Melbourne.
Fantastic. What a journey. And so you came to Melbourne, and then you were working in the public sector, I'm assuming, and then there was a decision to open your private practice.
So this is how we met Hanya, is through one of our mutual friends. So when I was going through training, two of my bosses, they approached me. I had worked with them in my first year and said, you know, would you like to come and work in Mornington when you finish? And I thought, yeah, I love these two people. I really respect them a lot. They're decent people, good surgeons. I'd love to. So as soon as I finished training, I did have a few public jobs, but I started working in Mornington. And they looked after me well. You know, I had a busy practice from the start, just did small things. And after a few months, that practice split into two. And I thought, okay, should I stay in Mornington or go and work closer to home? So after a lot of thinking, I thought, no, I'll leave. My kids were already at school in Melbourne, and then I got started working with a surgeon in Caulfield, And after about 4 or 5 years, we moved. We built a place in the city, and with one of my colleagues, one of my good friends, we opened Collins Street Plastic Surgery. We have our own businesses within this. So I've been here since 2012 and really enjoying it.
Yeah, fantastic. And what a journey that you've come to. And so have you found, as you know, as your surgery evolved and people coming to you, what's your practice made up of primarily in terms of the types of patients?
So my first practice in Mornington was mainly skin cancer and hands. I really didn't want to do anything bigger than that. But again, by coincidence, one of my friends asked me to go and look at a practice where he was considering to work, and he decided not to, but I did. This is in Caulfield, and that was mainly a cosmetic practice. And I again started doing small things. The owner taught me a lot of cosmetic operations, and I worked with him for about 5 years. And you start working in an environment, you do some operations, then you get more and more patients. So a lot of the cosmetic influence came from there, and I did learn a lot of things, and still kept working in public places. But in public, another surgeon who taught me a lot, Mr. Simon Donahue, he did a lot of breast operations, and I was his registrar, and then I worked with him at Monash, and he taught me a lot of things, and he had to take some time off, and he asked me if I could take over those lists, and I said of course. So I was doing sort of breast operations in private cosmetically. I was working with him in public, and that sort of became known for doing more breast reconstructions and breast work. So that is still continuing. A lot of what I do is breast cancer reconstruction, of the reconstructive part of my work, and other breast aesthetic procedures as well as breast reduction. That was one influence. The second influence is probably cultural. And when I got into plastic surgery, I thought, well, Iranians, they've got big noses. I'm sure I'm going to get a lot of people to have the noses done. So I better learn this too. So I went to Dallas and went to a course there, and I watched quite a few rhinoplasties, and I learned different techniques. And when my colleague in Caulfield retired, I did a lot of noses there. And so that sort of, I knew that was going to be something I had to do, but I do find that extremely fascinating and challenging, very challenging. A lot of people give up doing rhinoplasties because of that, but I really enjoy creating something, and again, it's very fiddly, which I enjoy. Same as breast reconstruction, there's microsurgery, which is very fiddly work. So these two things are most of my practice, breasts and
breast and noses. That's interesting, yeah. And I can see how, as you said, they sort of go together, because as you said, there's that microsurgery, the fact that you're dealing, with reconstruction, connecting all that tissue from vessels from different areas and parts of the body. Or with rhinoplasties, everybody who walks in is a different case. It's fascinating, absolutely. So that is something that you found your practice has become more of, those types of surgeries.
Correct. Yes. So a lot of rhinoplasties and a lot of breast work, and some other types of reconstruction as well. But they're a minor part of my practice.
Oh, fantastic. And you, so Mansoor, where do you see your practice heading? Still in the same direction as in the future?
It's funny that you think, okay, this man doesn't know where he wants to go, where he's sort of heading. But the aim for me is not to build a certain practice. I try to do as much as I can for people who walk in. And if I can't do something, I say, look, I'm sorry, I can't help you. But, the aim is to help whoever needs help. And it's very hard for me to say no to people. But, it's looking at what's happened over the past maybe 5 to 8 years. The more you do of one thing, the more people with the same problem come. Well, I'm not sure if my practice will change too much. Something that I did find, I suppose, new for me was repairing female genital mutilation, which I started reading about and discovering in 2015. I suppose that is an addition to my practice. And I got trained by an American surgeon in 2019. So that's, I suppose, something new that I'm hoping when the situation is a bit more stable, we can do a bit more of that in the public sector.
Wow, very admirable. The horrific situation of that genital mutilation and what those, I'm assuming just women have gone through that you're working with, and that you're able to help them again. That's amazing. That's just something. Good on you that you'll be able to help them with that as well. Well, Mansoor, your stories, as I said earlier, when I first heard a part of your story, it was an incredible journey that you went through all that, but still wanted to. Your family instilled in you the importance of learning and education, and not only your parents, by the sounds of it, your extended family as well. Your amazing uncle that is so successful in engineering, and you yourself. And at any stage, anybody who has experienced what you have may have been beaten down, and your human spirit might have gone, I can't be bothered going on. But instead, you rose to such amazing heights, which is fantastic. So congratulations, Mansoor.
Look, it's my mom. So this is something that I've taught my son, who doesn't speak Persian. He can say the sentence in Persian, but he doesn't even know what the words are. But one thing that my mom always says is that there is nothing that's impossible. You can do whatever you want, and that's her attitude to life. And I really, I always thought that my dad was the biggest influence on me, and now I realize that it's both of them. That every time, even now, when I speak to my mom, she has words of wisdom and keeps repeating that you can do whatever you want, and there's nothing that's impossible. And I remember it came to me, and it sort of flashed in my mind that when Trump won the election, and I thought, that's what she meant. This everybody thought this was impossible for him to win, and yet he did it. So there's absolutely believe that there is nothing that's impossible. Whatever you want to do, put effort into it and dedicate the time it needs with good intentions, and you'll get there. Doesn't matter what it is.
Yeah, very wise words. Well, Mansoor, thanks so much for your time today. I wish you all the best with your practice and your family. You're an inspiration, and thank you so much.
Thank you so much for having me, Hanya. Nice to see you and nice to talk to you.
All right, thank you.